Okay, great. Can you turn up is everybody turn up the volume on the voice? Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right now, we're just showing you a blue cannula. The camera's coming in from the back. The biceps tendon is right here. We're going to look at that closely. And then above that to the left, we can already see the rotator cuff tear. This torn tissue here is torn rotator cuff tendon. I'm going to use my shaver just to do some initial smoothing of the edges so we can see a little bit better. And now just that quickly, and if I slip behind the biceps, we can see exactly where this tear is, right here. Okay, so there's the rotator cuff tear. We're going to go ahead and fix that today for you. We can see how it peels off starting from the articular surface here. And we know from the MRI scan and the ultrasound that this tear goes all the way through the tendon here. We can kind of get a hint of that looking up at the top of the screen. See that hole? So we're going to take away all the bad tendon and reattach the cuff back to the bone here. We'll keep working here and show you some more in a minute. Okay, so we're finished trimming the edges from this side. There's the tear in the rotator cuff tendon. And now as we look down, this biceps anchor doesn't look that bad, so I'm going to leave it alone. This is one of the areas we always check. But as I tug on it, it's not loose and a little bit of fraying, but nothing to worry about. You don't really have any significant arthritis in the joint either, so I'm happy with that. There's the glenoid below and the humeral head up above. So I think we're looking good here. We're going to go ahead and change positions with your shoulder and get to work on this rotator cuff, working from the subacromial space. Okay, here we are using an instrument called the suction punch. It has suction attached to it, allows us to make a nice clean edge on the tendon. One of our favorite instruments. Okay, so now we're done getting the tendon ready for repair. You can see the hole right here. Let me use my shaver or my cautery as a probe here. So you can see the tear here. That smooth stuff is the articular cartilage. The front of your shoulder's to the right. The back of your shoulder is back here to the left. And so now that we have a pretty good picture, we can start to plan our repair. When we place our suture anchors down, this edge of the tendon should end up over here. And so you won't be able to see this anymore. Okay, so here you can see how we plan the repair. There's a spinal needle. That's the articular margin. We're going to place our anchor just a few millimeters lateral to the margin so we have room to heal. This is posterior. We can see we've got to get all the way back to there. So I'm actually going to place my first anchor here. It may take 2 anchors to get this done, but I'm going to place my first one a little bit more posterior, right about here. That ought to give us a good place from which to anchor the posterior aspect of this tear. Okay, so there's our first anchor. It's got 3 sutures, so it's what we call a triple loaded anchor. Okay, you can see there's a blue and white striped one, and a black and white striped one. We're going to reach in and get one of them. We'll take this black and white striped one first, and we're going to take it out of this anterior cannula. And now we're ready to pass a stitch through this posterior cannula. We're going to come through right about like that. Okay. Okay, so here's our sewing device. It's just a curved hook. You can kind of see it there. We're going to get all these sutures out of the way. I got it. And what's special about this is it's hollow. It's basically just a curved needle, and it's got a little black wire in the middle of it called the super shuttle, and that's what we use to move the suture back and forth. So we're basically just doing some sewing under the microscope, and our first stitch we'd like to get way back here. So that's what we're going to work on. Hold the camera there. A little bit, just pull back a little bit. Yeah, that's great. Okay, so here you can see how we make sure we get our needle underneath the entire thickness of the cuff, and then we feed that We retrieve it here. And then that black and white suture you see is going to go into the relay. We'll show you that in just a minute. Pause. Okay, so as we pull back, you can see that suture go underneath. And again, this is the posterior stitch. There it goes. And now when we move the camera here, we can look and get the partner black and white suture, which is right here. And so we're not going to tie this yet. We're going to tie that at the end, but that gives us our first loop, and you can imagine how that's going to snug that down right there. We're going to do the same thing several more times.